Okay,
Madam.
so, sorry, a few things happened. Get on with it. So today we are doing pathology. We have one more lecture in clinical methods and then we are done.
Okay.
So we are going to talk about the general pathology of infectious diseases. So that will be our topic for today. So we know about the major discoveries that have gone on in the microbial pathogenesis. The Edward Jenners and the Louis Pasteurs and the Robert Kochs, all that they've done throughout microbial discovery. So the serotyping and all that. So from all the work that has gone on in microbiology, we've been able to categorize infectious agents into the smallest being prions, and then the largest being some helminths. So tapeworm can be as long as 3 meters. Okay.
Okay.
So basically, microbes are all the ranges from very small to very big. So we'll look at some of the host barriers that help us to keep out infection. So these are the barriers at the various entry points in the body. So we have the skin, we have the mucous membranes, and then we also have the respiratory tracts, the genitourinary tract, and then the gastrointestinal tract, the respiratory tract. These are the places that microorganisms can enter into the body. And so these places have they are like the gates at which microorganisms can enter. Okay, so when you look at the various barriers, there are peculiar things there which help us to fight infections. So let's start from the skin. The skin is a very tough barrier which is responsible for keeping out a lot of microorganisms. All this admitting people in just tends to distract me a lot. Okay, so let's look at the skin and look at the things that help us to fight off infection from the skin. So the first is the epithelial type of the skin. The skin is a dense keratinized epithelium. Then also the pH of the skin is a low pH between 5.5 and 5 and 5.5. So it helps us to keep out microbes. Then the fact that it is dry is also good. When the skin becomes wet, it's more permeable to microorganisms. And when it is also warm, it makes it even all the more permeable. So for example, organisms like human papillomavirus and genital warts, they are able to penetrate the skin during sexual intercourse because then it is warm and less easily. Other things that help with infection at the skin is the fact that some microorganisms are able to penetrate the skin. Nick,
hello,
can you be co-host so that you'll be doing the admissions?
Okay. Let me see. Doc, see
Yeah.
if you can select my name and see if you can make me co-host.
Okay, let me do that. So from the list of participants.
Yeah. I think you point there.
Okay, so I found you, but there's more. Okay, let me see. Make host. So maybe I can make you host for the meantime, and when I finish.
Okay.
Or that means I won't be able to share the slide.
So I can okay, when you make me the host, I will change the security settings and allow you to share the host. to share the screen, your screen, for us to see.
All right. Okay.
Yeah.
So let me make you the host.
Okay. All right.
Because it distracts me. People keep
Yeah.
entering, I keep admitting them. It distracts my train of thought.
Okay. Oh, but I think you are even sharing your screen already.
Yes, I'm sharing my screen, so I can proceed.
Yeah, you can proceed. So I'll do the admitting.
Okay. All right. So the urogenital tract. So we've looked at the skin, and we've looked at the fact that when it's dry, and when it is the pH is high, when it is intact, it serves as a barrier. So when it is warm and moist, it allows microbes to enter, like the sexually transmitted diseases, syphilis, genital warts. Then when the barrier is broken, like schistosome is able to produce certain toxins that digest the skin just around this vicinity so that it can enter and cause infection. So let's come to the urogenital tract. Now, in the urogenital tract, you're looking at the urethra. Okay, that would be the entry point. Now, the urethra of males and females are different. The urethra of the male goes through the penis. And so it is obviously, the penis is much longer than the urethra of the female. And because of this anatomic difference and the fact that the urethral opening is close to the anal area, that predisposes to a lot of infection from fecal flora. And so these infectious agents will get into the urethra and cause infection, which is known as a urinary tract infection. This is facilitated, or this occurs more common in females because they have a small urethra, a shorter urethra, and then also because of the proximity around the urogenital area, the anal area, because the organisms are mainly from fecal flora. So E. coli, Klebsiella, all those fecal flora. If the perineal hygiene is bad, let's say if the woman or if it's a child, whoever, wipes from the back to the front, you bring the fecal organisms to the urethral area and you can facilitate an infection. Another thing that facilitates infection is when you have sexual intercourse, because there's trauma to the area, so the mucous membrane might be broken by the trauma. And then also the fact that there's a lot of activity around that area, fondling and whatever goes on during sex. And so that also can bring microorganisms from the anal area to the urethral area because the distance is very short. Okay. Then if you have a situation whereby there's an abnormality in the urinary tract, like reflux of urine as often as they should, then there'll be a buildup of urine in the bladder, and that increases the tendency of the urine becoming infected. So all these factors can lead to urinary tract infection in the urogenital tract. Okay. So looking at the respiratory tract, you have a lot of respiratory organisms in the air that we inhale, viruses, bacteria, that we inhale on a daily basis. Now, the reason why we don't get infection is because we have barriers in the respiratory tract. So let's start from the nose. You have hairs in the nose which trap bigger microorganisms in there, and then dust. Then moving down, you have cilia, which beats in one direction and blow away the microorganisms. Then we also have mucus, which traps the microorganisms that we inhale. And so once in a while, when the mucus is produced and it traps the microorganisms, we cough them out into the exterior so it doesn't get into the lungs. Now, if the microorganisms get into the lungs, the ones that will get into the lungs are the very small ones, like the ones less than 5 micrometers in diameter. They will travel directly to the alveoli because they are light. So when they get there, we have pulmonary alveolar macrophages, which would phagocytose them and destroy them. So that is what happens at the respiratory tract. So if you have damage to the mucociliary defense, like if you have somebody who smokes and has destroyed all his goblet cells which produce the mucus, or you have an injury to the cilia, or you have a congenital problem whereby you are born with abnormal cilia, like immotile cilia syndrome, which is also called Pathogenesis syndrome. These people will be prone to having a lot of problems. Or if you have cystic fibrosis, whereby the quality of your mucus is decreased, then you would also have repeated respiratory tract infections. Some of the microorganisms also produce hemagglutinins, which kill the bacteria and help them to cause an infection. Then something like Mycobacterium tuberculosis, it escapes phagocytosis by killing the macrophages, and so it can cause an infection inside the lungs. So let's come to the intestinal tract, or the GIT. So a lot of the infections in the GIT are transmitted by the fecal-oral route. What this means is that there's fecal contamination of the water or the food that the person takes in, and then when you take it in, it infects, it causes the infection, and then the cycle repeats itself. So usually the problem with the infection in the GIT is when there's insanitary disposal of waste and there's impure drinking water, hand washing becomes a problem, or food is not cooked thoroughly. So whenever you have hygiene problems, diarrheal diseases would abound. Now, the normal defenses that we have against ingested pathogens that are taken in through the GIT are 4. We have the gastric acid. Because of this low pH, it destroys a lot of microorganisms. Then you also have a mucous membrane, or a viscous mucous layer of the GI, which is slippery and forms a film. So it protects the GI from penetration by microorganisms. Then you also have pancreatic enzymes and bile, which also help with killing by acting as detergents. Then finally, we have immunoglobulins, which are at the mucosal surface of the GIT, and they are called mucosal associated lymphoid tissues. These also help in fighting infection in the GIT. So if you have a situation whereby you have a GI infection, it can be weakened by low gastric acidity. So if you have a situation whereby anything decreases the gastric acid that you produce, then you are prone to infection. So patients who take proton pump inhibitors, medications that decrease the acid secretion of the stomach, would be more prone to gastric infections. Then if you take a lot of antibiotics, you are in the habit of taking a lot of antibiotics, they upset the balance, the normal balance in the GI, and can predispose you to getting infection. Then if there's anything that decreases peristalsis or causes an obstruction of the transit of food along the GI, it means that there'll be a problem with the secretion and digestion, and so you can also have an infection as well. Okay. So a lot of GI disease goes through, it happens because of certain mechanisms. We have enterotoxin release. So some organisms like Staphylococcus aureus, which can infect food, would release enterotoxin, and it's the enterotoxin that will cause the infection. Some organisms like Vibrio cholera and E. coli would release exotoxin, which will cause infection. Some too would damage the intestinal mucosa, like Salmonella and Campylobacter. The organisms that damage the mucosa are the ones that would usually cause bloody stools. So if you have an organism that is able to penetrate the mucosa, there will be some bleeding because it invades the mucosal barrier. Then some organisms too can cause systemic infection because they enter into the Peyer's patches. So an example is Salmonella typhi. So even though Salmonella is taken in through the GI in infected food, and it will cause typhoid fever. You can also have that infection getting into the Peyer's patches, into the bloodstream, and causing a generalized infection. Okay, so typhoid fever can affect several organs of the body, even though it is introduced through the GI. So this is a mucosal membrane of a patient who has been infected with Shigella. You realize that there's a lot of erythema, ulceration, and then formation of pseudomembrane, which is the white plaques that you see. So this is a picture of an intestine of somebody with Shigella colitis. So in the GI, you can also have fungal infection, but usually this is not common. This usually occurs in patients who are immunocompromised. So Candida, for example, can also cause an infection, but you will only find it in immunocompromised patients. So patients with HIV, you'd have oropharyngeal candidiasis as a result of this. The GI is also a place for infection by protozoans. So like Giardia lamblia, I'm sure you've done microbiology. So Giardia lamblia, Microspora, Isospora belli, Balantidium coli, and so on. Okay. So an organism like Giardia lamblia will attach to the epithelium and invade it and cause bleeding. Then some too can cause ulceration, and some too would be taken up by the enterocytes or the enteric cells and cause gametes and then form spores. The spores will be the infectious agents, which when they are passed in the fecal matter and then there's improper disposal, it can propagate the infection further. So this is Entamoeba histolytica, which causes amoebiasis. Then we can also have worms in the GI, helminths. So ascaris, we can have tapeworm, we can have pinworm. So ascaris, for example, they can multiply very rapidly and entangle themselves and form a mass which can physically block the GI tract. Then you can also have hookworms, which would attach to the GI by their suckers and be sucking blood from the GI, which can lead to anemia. Okay, so let's look at the spread of microbes throughout the body. So microorganisms would usually spread along wet epithelial surfaces. So in the intestines, in the lungs, in the genitourinary tract. And others are also able to penetrate because they produce enzymes. So for example, Staphylococcus and Streptococcus, they produce an enzyme called hyaluronidase, which degrades the connective tissue or the soft tissue and causes and helps the microorganisms to spread in the connective tissue. Then other organisms too are transported in the blood by various means. So if you take hepatitis B and polio, they are usually transported free in the blood. If you take organisms like HIV, CMV, Mycobacterium, they are carried by leukocytes in the blood. So then other organisms like malaria, they are transported by red blood cells. So the way of, let me just summarize this. The transportation can be by production of enzymes, which breaks down the connective tissues and facilitates the transportation of the organism. Or the transportation can be through the blood, whereby it can be carried by leukocytes, for example, cytomegalovirus or HIV, or it can be transported by red blood cells, for example, the malaria parasite, or the organism can be free in the plasma, for example, the African trypanosomiasis. Okay. Now, the spread of the microorganisms throughout the blood to other parts of the body can cause a systemic infection or a generalized infection of the entire body. And usually this can lead to a massive infection in response to the bacterial endotoxin that is secreted. When you have an infection from one place causing a generalized infection in another place, that place becomes a secondary foci of infection. And the primary focus of infection is where the organism entered from. And then the other sites where the infection occurs is a secondary focus. And this, as I said, can occur by carriage through the blood. And other organisms also spread throughout the body by penetration and then circulation through the portal system. So an example is Schistosoma mansoni. Then others too can enter along the neural channel. So an example is poliovirus. Then rabies too can find its way in a retrograde fashion along the nerves to cause the infection in the brain. Okay. So this is what I was trying to, the pictorial representation of what I was saying, that the microorganisms enters through the skin, the lungs, the urinary tract. So when they enter, they can go through the lymph nodes, through the lymphatic system into the bloodstream. When they enter the bloodstream, they can now go to several parts of the body and cause the secondary focus of infection. So if it goes into the kidney, you can have a pyelonephritis. If it goes into the salivary gland, you can have mumps or rabies. If it goes to the liver, you can have a hepatitis. If it goes to the lungs, the secondary, so what I'm talking about are the secondary foci. So measles and rubella can affect the lungs and disseminate to cause an infection. Then the skin, chicken pox, yaws, and then the brain, poliomyelitis and rabies. Okay. So let's look at fetal infection. So fetal infection means that the mother is pregnant and the infection that she has is transmitted to her fetus in utero. Now, fetal infection is time bound, and it's also depends on how much of the organism goes in. So when I say time bound, what I mean is that if you have a fetal infection at the early part of the pregnancy, it can either lead to fetal loss or there'll be nothing will happen to the baby. If it happens during the critical time of organ formation, then it can have a teratogenic effect. What I mean by teratogenesis is that it can cause a congenital abnormality of the fetus. If it happens in the third trimester, it can affect growth, but it may not give any problems. So let's use rubella as an example. Rubella infection in the first trimester can cause a congenital heart defect. But if you have the same rubella affecting the mother during the third trimester, it causes little damage. Okay. Then fetal infection. Let me say one more thing about fetal infection before we talk about disease transmission. So fetal infection can occur by two routes, either hematogenous routes, that is through the blood to the placenta to the baby, or ascending infection from the female genital tract, that is an infection from the vagina into the membranes, the chorion, the amnion, and then infecting the fetus. Usually, there is a cervical mucus plug, which is at the entrance of the cervix and prevents microorganisms from entering. So it doesn't mean that when a woman is pregnant and she has sex, if there are any bacteria in the semen, it will go to the baby and cause an infection. No, because there's a cervical mucus plug which is at the cervix and prevents infection. So when a woman goes into labor, you realize that she'll lose the mucus first before, if maybe her water will break, it will break. So infection can only occur in an ascending order when there is breaking of the membrane. So maybe she's leaking liquor. She's not supposed to pass fluid. The fluid around the baby, the amniotic fluid is passing out, then that can be a channel for which infection can go up. Otherwise, it is not something that happens commonly. But the hematogenous spread, that is spread of infection through the blood vessel, happens more often through the blood of the mother to the placenta and then to the baby. Okay, so let's look at disease transmission. So disease transmission occurs when the microorganism that has been cleared from one person gets into another person. And this occurs from the point where the microorganisms are shed. So for example, if you shed the microorganisms through the skin, or if there's shedding from the respiratory tract by coughing, sneezing, or singing or saliva production, that can also be a mode of disease transmission. Then you can also transmit some organisms by urination, for example, schistosoma, and then also by defecation if the organisms are in the stool. So during disease transmission, the microorganisms also have to be resistant to the environment so that they'll be able to reinfect the next person. So stool pathogens, for example, are resistant to drying. So those, for example, the protozoa, they'll form cysts or they'll form spores, which will survive in the environment until it is picked up by the next host. Then some viruses can be passed from person to person by direct contact. So an example is hepatitis B. Then viruses that can be transmitted in the salivary gland, for example, the herpes virus, mumps. So during talking, singing, anything that, kissing, spitting, anything that releases saliva can be a mode of transmission because the microorganism is shed in that bodily secretion. Then we can have sexually transmitted infections which are shed in the secretions, either vaginal secretions or by the semen. So you have several of them: chlamydia, syphilis, and so on. Then we also have microorganisms that are transmitted by blood from arthropods. So you can have ticks causing infection, you can have mosquitoes. So these organisms will take up a blood meal and then they release the infectious agents in the process. And then they can cause an infection to be transmitted between humans by attacking several hosts and transmitting the infection across the hosts. Okay. Now, how infectious agents cause disease? There are three general mechanisms. So they can cause disease at the point of entry of the organism into the host cell. Then they can also release endotoxins, exotoxins that can cause infection. Then they can also attack the host response and cause additional damage. So for example, HIV affects the immune system and causes generalized immunodeficiency. That is the way by which it causes an infection. Okay. So let's look at also the ways by which microorganisms evade the immune system. So we looked at the barriers that the body creates to these microorganisms. But some way, somehow, the microorganisms are able to evade the immune system and cause an infection. How do they do this? So the first thing is by remaining inaccessible. The second is by cleaving antibody. And then the third is by varying or shedding antigens that they shed. And then the fourth is by causing immunosuppression. So we look at these one by one. Seems today our time has run. So remaining inaccessible, microorganisms will hide in a place where the immune system cannot affect them. So for example, malaria parasites entering the liver. So they hide there and the immune system is not able, because the immune system is not going to attack the liver. So that is one way by which microorganisms would evade the immune system, or they will trick the immune system. Then the other thing is by resisting killing by the immune system, or they would cleave the antibodies. So an example is E. coli, which produces K antigens, which will prevent the activation of complements. Okay. Then varying or shedding antigens. So the influenza virus, influenza virus changes its antigen, its surface proteins. You know that the surface protein is what the immune system would recognize as foreign and produce antibodies against it. So if it changes its surface protein, it means that the immune system would produce an antibody. By the time the antibody gets into the system, the antigen has changed. And so that antibody that was produced previously is useless, and the infection continues going on. So this is another way by which microorganisms evade the immune system. Then the other way is by causing immunosuppression. So generally, the microorganisms would suppress the immune system so that the immune system is not able to fight or rise up against it. So examples are HIV and Epstein-Barr virus. Okay. So this is, we are getting to the end. This talks about how we can detect microorganisms by staining methods. So there are several staining methods which are used. And so you can have the H&E staining method. You can have gram stain. You can have acid-fast stain for mycobacteria and nocardia. You can have silver stain for fungi. Giemsa stain for malaria parasites, Leishmania, Campylobacter. You can have culture for all microorganisms, but viral cultures are usually more difficult to do than the bacterial cultures. And then you can also have DNA probes, which are special techniques for diagnosis. So for example, with the COVID pandemic now, the DNA sequence has been released. So that is what is used to test for the COVID. So if the sequence matches the DNA sequence of COVID, then you say that you have the COVID-19 or you have the coronavirus, SARS-CoV-2. So that one is highly specific because it is using the DNA and it can test for several things: viruses, bacteria, protozoa. I think this is the last slide. Oh, okay. Inflammatory response to infectious agents. So the inflammation that is produced as a result of the infectious agent sometimes can be pathognomic to the particular infectious agent. So you can have suppurative inflammation, mononuclear inflammation, whereby, so the suppurative inflammation is the kind of inflammation that will lead to pus formation. You have a lot of neutrophils, and usually that occurs in bacterial infections. Then the mononuclear inflammation usually occurs in patients with viral infections. Then we can have cytopathic or cytoproliferative inflammation, usually also in viral infections. Necrotizing inflammation occurs in very severe infections, which produce a lot of cytokines as well. Then chronic inflammation usually occurs in infections that are long-standing, for example, tuberculosis, yours, and so on. Okay, so in those days, I used to add the assignments to the slide, but not now. Okay, if there are any questions, we have 5 minutes more. Hello?
Any questions?
Any questions, please?
Question.
Only
Yes.
unmute your microphone.
Hello.
Yes. Please ask your question.
Mommy, please, I want to find out how does vibrio cholerae evade recognition in the
Pardon?
system?
Pardon?
Vibrio cholerae.
Uh-huh.
I'm saying, how does vibrio cholerae evade being recognized? Malaria height in the liver.
How does it do what?
Like, how does it evade being recognized by the immune system?
It produces toxins. So you're talking about cholera infection?
Yes, Mom.
Yes, so the cholera could cause more water to be secreted into the intestine, and that is what would cause the diarrhea. So that is how it causes infection. Any other questions?
Thank you.
Any other question? We have 3 minutes.
Or maybe you didn't come early, so you can't.
Mama Esther, today you're not asking a question.
No, I don't have any question today.
Doc, where does flagellates fall? Do they fall under helminths?
They fall under protozoa.
Protozoa, okay.
So, yeah, they fall under protozoa.
Okay.
Any other question?
No question for Dr. Maria. Okay.
All right, then we'll call it a day. So tomorrow we'll have our last lecture
For clinical methods.
Clinical methods, and then subsequently we'll be doing pathology.
Pathology.
Yeah.
Okay.
Okay.
Right.
Thank you very much.
Thank you very much, Doc.
It's 8. 8. Usual 8.
8 a.m.
Yes, 8 a.m.
Okay.
Yes.
That's okay.
Okay.
Thank you very much.
Doc, thank you very much.
Okay. Madam, tell Akusia that I owe her one chocolate. She didn't this time.
No, she's not yet.
She's not here.
Ah,
Okay.
She's a member of our class.
I don't mind her.
She's a member of our class, so she's invited anytime. All right, Doc, thank you very much. Have a good evening.
You're welcome. Have a good evening.
yeah. Bye-bye.
Bye.
Bye.
Yeah.
Hello, Nick.
Yes.
Edema note no farmer.
What's it?
Note edema dear edema woman.
Obviously, there's anybody in the back.
Okay. Yeah, thank you very much.
Right, you're welcome. Okay, guys, I'll meet you guys tomorrow morning at 8.
Okay.
All right.
Bye-bye.
Bye.